when you are done.
Okay. Y'all ready?
Yes.
Okay, good afternoon. We have some very good news about our vaccine efforts in our state of Washington. And before we get to that, I wanted to make a few comments about the education of our children, which is certainly of great importance to the whole state. And I'm pleased to say I've been seeing some great efforts by our educational community, both on-site and remote learning, educators who are being as innovative as possible. And I'm pleased also to say that now more than half of our schools have returned on-site instruction in our elementary school, which I think is a good thing. Roughly half of the elementary school students in our state are currently back in the classroom where they can receive on-site instruction with their excellent educators and their staff. I think this is great progress for two reasons. Number one, we all understand that in-person learning is the best environment for students. It is the best environment to have that magic relationship with their teachers that means so much to them. And second, we know that in-person learning can be accomplished across our state with safety when we use the protocols that we know that work in the state of Washington. Now, how do we know that on-site learning can be done safely? It is because on-site learning is being done safely across the state of Washington. I have been doing a tour, as you know, of schools across the state, and I've seen repeated instances where schools have figured out a way and educators have worked together to find a way to educate our children on-site. And that is all kinds of schools, in urban schools and rural schools, in the east and western part of our state, in schools where I've seen where 32 different languages are spoken, in schools where there are much less dual language learners, in schools that have large communities of color, up 60% communities of color, and those who do not have that type of diversity. In schools of areas that have old buildings and new buildings and everything in between. Our educational community has shown us that they can do this job on site, and that is good news. And now that we know this, it is reasonable to expect, and we do expect, that schools will provide on-site options for parents and students in the near future. Because even without having our school staff vaccinated, we know that we can get this job done. And we now know that in the upcoming weeks, our educators will have options to become vaccinated. So we know that this can be done. We want to thank everybody in their efforts to work together to get this job done. It's the best thing for our students, and I think the whole community at large. With that, I wanted to have a couple other leaders address this issue. Seattle Mayor Jenny Durkin and Senator Reuven Carlisle. Mayor, could you make a few comments?
Thank you very much, Governor, and it's really not it's been a year. In this type
Madam Mayor,
listening to the scientists and the public health experts.
Madam Mayor, can we pause just for a minute? Yeah. We're having some difficulty hearing you. I don't know if your video's on, but could you start again? We'll try another time.
Sure.
Go ahead, that sounds better.
All right. I just said, Governor, thank you for having me here today. It's an honor to be with you and Senator Carlisle. It's hard to believe it's been a year. But during this entire crisis, your leadership has been invaluable to the city of Seattle and the whole state. And I think together, our North Star really has been listening to the scientists and the public health experts. 1 year later, we've shown that our collective efforts have worked. They've taken an enormous toll. I've sat with so many families who've lost loved ones, lost their jobs, lost their businesses, but they continue to do what we ask of them. And as we have this hope on the horizon of vaccines, I agree with you so much that we've got to find a way to get our kids back in school. We're fortunate in Seattle because people have sacrificed so much and have listened to the guidance that we have the lowest cases and hospitalizations of any major city in America, even though we were the initial epicenter with no guidebook. And this pandemic, though, has really exacerbated every single one of our social inequities. And that includes the opportunity gap in our low-income students and throughout our state, but particularly here in the city of Seattle. We are really hoping that we can reopen schools so that we can get the support that we know our students need. You know, as you know, Governor, my first job out of college was a high school teacher for 2 years. And one of my nieces is teaching now back in the classroom recently. And she's talked about how the faces of the children and the ability for them to get back together with their peers in the classroom, be with their teacher, has helped them so much, because we know that this has been hard on the kids. It's been enormously hard on the parents. We know it's really challenged our teachers themselves to try to connect with their students. And we also know that the levels of depression and anxiety and stress in our young people has been very extreme. And we also know that not having the in-class education really sets our kids back, particularly our kids of color who are already struggling with the opportunity gap here in our Seattle schools. Every month they're not in school jeopardizes their future. We are at the next moment of reopening our region and including our child care facilities. As part of phase 2, we've seen a safe reopening of more of our businesses, but we're keeping a close eye on it. The CDC has recommended that we can reopen and remain for in-person instruction, especially in regions like ours, where we have been taking the guidance so clearly, and we'll continue to do that in the schools. They've issued guidance and said schools should be the first to open, and K through 12 schools should be the last thing that we close if we have another uptick. We know that families, teachers, children all want our schools to open, and I'm really hoping we can do so safely and soon. Our local public health experts here in Seattle, King County have said they can reopen safely if they use the proper guidance. We've been having and operating child care centers throughout this. Since the beginning of the pandemic, city-operated child care and many of the providers that we fund have remained open safely throughout this pandemic. We also opened teenage hubs for our teenagers in schools who wouldn't have other ways to get together with peers, mentors, tutors, and learning. And our programs are serving 1,200 students in childcare programs, and our teen learning hubs have over 200 students. I also just want to tip my hat to the city workers who've been showing up every day throughout this pandemic on the front lines, making sure that we can provide the services we need. And the child care operators who've also taken in child care, which has been so fundamental for our healthcare workers, for our frontline workers, for our city workers who need that child care to do their jobs. We know that early learning is so critical for educational equity. In our Seattle preschool program, 74% of the students are students of color. Nothing during this pandemic has been easy, but nothing has probably weighed on our hearts and minds more than the struggles our families are having. And among those is the impact this will have on our children and their futures going forward. But I'm really happy, Governor, that we look like vaccination is on the horizon. As you know, the city of Seattle has been working hard with your Department of Health and King County Public Health, and the efforts we've done to really fill that gap in equity has paid off. 70% of our doses have gone to BIPOC communities that otherwise would have been left behind, our BIPOC elders and those over 65. And in the coming weeks, we'll be vaccinating as many people as we can. And of course, as soon as we have enough vaccine, now that teachers are eligible, we hope to have and assist with the state and other efforts to vaccinate our teachers. And King County has surpassed 50% of the 65 and over people have been vaccinated. And we will continue to assist in that program. We know that the supply has been so frustrating to everyone, but we will get more soon. And I'm very excited that Johnson & Johnson gives us a third safe alternative. I'm very proud to report that we did a test of our Lumen facility and that we will be able to vaccinate, we think, 4,000 people per week. And it is our road to recovery. But we know we have to get those students back in the classrooms to operate safely. School